The Stop the Bleed campaign is a nationwide campaign endorsed and supported by the American College of Surgeons, and it was written by the NAEMT, the National Association of EMTs, and it's also endorsed by the White House to provide education, training, and resources to our lay people, our immediate responders, such as our school teachers, our principals, our school staff, our students, civic groups, church groups, and so forth. CAMC has taken a front-leading step in providing this education and resources to our immediate responders and our communities. So what is the Stop the Bleed campaign? The Stop the Bleed campaign talks about how are you going to stop bleeding if it is uncontrolled hemorrhage. First of all, recognize it's uncontrolled hemorrhage, and how are you going to stop it? It's an ABC approach. A, I need to alert somebody. I need to call 911. B, is the blood coming from an artery or vein? Is it blood coming from the arm or the leg, the head, the neck, the torso? Or is it blood coming from the abdomen or the chest wall? If it's coming from the arm or the leg, it's simple. Can I stop it with direct pressure? And if not, then I need to go to a tourniquet. If it's coming from the head, the neck, or the chest, the neck, or the groin, then I need to apply some form of a gauze packing. And so what we're using here is the Quick Clot gauze package. This is it's a hemostatic agent. It's used by the military. That's where we got our information from it. And so what we do, you see the simulated gunshot wound in this leg here. We notice the gunshot wound, the bleeding's down inside there. What we have to do is use this Quick Clot, and we're going to start packing this wound with this gauze as tight as we can, filling up the cavitation of the wound itself. Once we have packed this wound as tight as we can get it, then we're going to take the excess gauze and we're going to apply a packing or a dressing over top of the wound and hold direct firm pressure over the wound itself. And we're not going to ever release pressure. We want to keep pressure down firmly against this wound to stop the bleeding. If it's on the arm or the leg and we can't stop the bleeding with direct pressure, we're going to put a tourniquet on. Now, we can't put tourniquets on the neck, the chest, or the groin, but we can on the arm or the leg. First thing is get the white strips pulled back and get it out of your way. That'll be where we put the time on the tourniquet. The next thing you want to do is to put this strap on the patient's arm, and you want to pull this as tight as we can possibly get it, okay, like so. And we're going to bring this strip around here to where it just stops right at the edge of the clamp. I'm going to take my windlass rod and I'm going to wrap this clamp as tight as I can get it until the bleeding stops or the pulse goes away. And you notice the bleeding has stopped. And now I'm going to take my windlass rod and I'm going to lock it and secure it into that clamp. I'm going to take the rest of my strap here, and first thing I'm going to do is tuck it all down in the clamp. I'm going to come over my windlass rod on the first ramp. And if I have enough strap, I'll come again and I'll come through the clamp again, and the next time I'll make my X and I'll come under the windlass clamp. The final step is to put this strap over the rod there. That locks it all nice and neat and in order, and I want to document the time that I put the tourniquet on the patient. After we educate and we train our lay people, our immediate responders, the next step is to equip them. Our part of the equipment is the Stop the Bleed wall station that we're putting in our schools, our churches, our civic groups, and organizations. This particular Stop the Bleed wall station is a 5-pack kit, and when we open this kit, this is what you'll see in your schools. This one has a go bag, and in this go bag you have 5 individual Stop the Bleed training kits. In each training kit, you have a tourniquet, you have the Quick Clot gauze, you have the trauma gauze, a Sharpie, a pair of gloves, and a just-in-time instruction card. Some of these kits have 8 packs, some have 5 packs. This particular one is a 5-pack. Also in each kit is a litter. It's a quick litter. You roll it out, you put the victim on the litter. It has handles on the side, so if you need to carry that victim to a safe location, get them in an ambulance or a helicopter so they can be taken to the trauma center, that's what this litter is for. So our goal is to have one of these Stop the Bleed stations in every school by the end of the 2019 school year. So June of 2020, we want to see one of these kits in every school in West Virginia.